we thought it might be useful to look at some of the instruments in the handset. So I'm going to introduce you today to Myla.
Hello.
Myla has been here so long that if we have a mind blank and ask for the thingy, she knows exactly what to put in our hands. But if you don't know what the thingy is, we'll just walk through some of the instruments now. So you'll see them all done up on a big clip here. Myla, could you undo them and we'll show them one by one what these things are.
Okay, we start with scissors. So we have 3 different kind of scissors. That's the nurse's dressing scissors, Tulotomy scissors, which the hand surgeon loves, and the small Mackindale scissors.
Let's look at the Tulotomy scissors next to the Mackindale scissors. And the key thing to notice there is the shape of the end. So the Tulotomy scissors have those lovely triangular points, useful for dissecting. If we look at the Mackindale scissors, they're much more rounded. You open them up, Myla, we can see the blades. There we go. Much more rounded. Okay, after the scissors, what have we got next?
So we have these mosquitoes, as everybody calls it, clips. So we clip the vessel to stop from bleeding.
Now these ones are particularly nice mosquitoes because they've got fine points. Sometimes you can get quite chunky clips because you're going to put those straight clips on, and we can put those next to them. So those are great. The Americans call them hemostats.
Next
and
one
got some chunkier
are the
types here,
straight mosquitoes.
and those are the straight ones. So the difference between the curved and the straight, the curved ones stay out of your way, so you can see what's happening at the tip. The straight ones, not quite so easy to see what's happening at the tip of the clip there. Okay, and what else have we got?
We have tissue forceps. It's called Alice, used for
So
picking up tissues.
So if you open them, Myla, then we can see they've got very fine teeth. Can you see that? And that's really helpful for picking up and putting some tension through fine tissue. So I use them when I'm dissecting Dupuytren's cords. Okay, and then we've got back here the Diathermy Forceps. There we are, and they plug in to the diathermy cord, which is there. And this is bipolar for hand surgery. We use bipolar where we've got nerves and we want to keep them safe. Okay, can we go on to those retractors?
We have the smallest one, which is the arms.
This is an arms retractor. I think it's pointless, but you might find it helpful. There's not much power in it.
And the bigger one is called the West.
This is a West. Right, if you turn it out the other way, there we go. So the key thing about the West, if you open it up, those forks, they're blunt. That's what you want. You don't want sharp, pointy things going through soft tissue. And they're on a ratchet. And you should be aware of the self-retainer, because if you can put a self-retainer in, then your hands are free to do something else. Okay?
Okay. And other retractors are called cat's paws and skin hooks.
Okay, so if you turn those cat's paws, then we can see why they're called cat's paws. Very imaginative, us surgeons. You can see how sharp those are. If you are holding them so that you can use the other end, just watch you don't put them through your gloves. Okay, and then the skin hooks, these are quite fragile. Again, useful for just picking up the skin layer, nothing more than that, because they're quite sharp and pointy. And you can see from the one on the right, it's been rebent back into shape a couple of times. They're quite delicate. Now, let's go on to those.
The bigger version of cat's paws other end, Langenbeck.
So this is the Langenbeck. This comes in a variety of sizes. I think pretty much most specialties have a retractor of this nature. I would not be tempted to put your finger through there. You can give yourself a neuropraxia if you're retracting for a long period of time. I had a numb index finger for 6 months. Should we look at the different forceps?
So that's Adson's. That's gillies and that's lanes.
Okay, so the Adsons are the finest with the single tooth there. Then the gillies, again, these are probably the two of the most commonest sizes used in upper limb surgery. And then lanes, I haven't found a reason to use those. They're very big. Okay, and then finally, should we look at the McDonald's and the needle holder there? So this is a McDonald's. This is McDonald's as in old MacDonald, not McDonald as in McDonnell Douglas. And it's got a curved end and a straight end, and it's a multi-purpose tool. Can you turn it on its side, Viola? And you can see you can use that beautifully for fracture reduction. You can also, what it's designed to be is a tissue dissector. So you can ease it through tissue planes, and it's blunt, so it will find the plane around, for example, a ganglion cyst very nicely. Very useful instrument, that. And then finally, we'll look at the needle holders. There we go. So those are the instruments on a handset. And Myla, thank you very much.